Assalamu alaikum and welcome to the Dr. UUT lectures. In today's discussion, the topic is about the eyes, and this is actually a very serious problem of the eyes, okay? That is amblyopia or lazy eye. Before I get right into the discussion, what is amblyopia and what is its treatment, I want you guys to know that this is the disease that is affecting the kids. Yes, kids, okay, kids. Now, what is the age of the kids? The kids are actually the young ones, less than 8 years. Okay, as your kid crosses this particular age limit, that is 8 years, then this particular problem is no more gonna be solved. Okay, so you must solve this problem before this particular age, that is 8 years. And there are some chances if your kid crosses this particular age limit up till 18, and then after that it is approximately impossible to treat this particular problem. Now, what is this amblyopia or lazy eye? The name indicates lazy eye, and remember, this is not about a single eye. Sometimes it may affect both the eyes, and mostly it affects only one eye. Now, what is amblyopia? How it is affecting the eyes? Very simple. You guys know that very well that we have a brain and two eyes. As the kid starts growing during this period till 8 years, what is happening inside the body? That is very simple. The eyes start connecting with the brain. What happens now in some cases, now here is the point that will make you people understand about the lazy eye or amblyopia. Very simple. In some kids, one eye starts connecting with the brain, whereas the second eye starts connecting in a very slow manner. So what happens is the kid grows with the passage of time, one eye gets full vision, whereas the second one gets low vision. Now in this case, when one eye is fully developed and the second one is developing in a very slow manner, then in that condition, that particular kid is not able to have clear vision in his second eye, the one that is affected. And in some cases, remember, these both eyes may be affected, and in that case, the particular kid is not able to have clear view of the surrounding. So what to do now? Very simple. We must treat this particular kid within this particular age period. This kid must not cross 8 years, and if this kid unfortunately crosses this age, then it becomes difficult to treat this particular problem. So now, before this problem aggravates or worsens, please take your kids to nearby eyes specialist. And I hope you got what I said. And if still you have confusion, drop that in the comment box. We'll come with answers very soon. Thank you for watching.